Hello, friends. A very good evening to all of you. Today, we have the wonderful opportunity to have with us one of the experienced urologists who is going to share his FRCS journey, his experience with us. And that is going to help a lot of candidates who are aspiring to become an FRCS urology and pass this very challenging exam. So today we have Dr. Abdelazem. He's currently working as a consultant in the Northern Ireland and extremely thankful to you, Dr. Abdelazem, for taking out time from your busy schedule and you decided to share something
Welcome.
with us.
You are
And
welcome, Ankit, and also
thank
for
you
our
so much.
friends.
Thank
No
you so
problem.
much. So,
Thank
Dr. Abdelazem passed his FRCS in 2023, and he has been guiding a lot of students after that, including me, and it has been a great learning experience from him. So, Dr. Abdelazem, let us hear from you, and a lot of congratulations for you for getting a job in as a consultant
Thank
in
you very much.
Ireland.
Thank you very much.
And
It's
so,
kind from you that you make this interview with me. Actually, I was embarrassed in the start from your words for my
this
experience
is
and
all
like
that
that.
you deserve. That's all the words that I said.
Not at
Actually,
all. Thank you very much. That's very kind from you. Actually, um,
we would like to hear from
I
you
hope I
regarding the FRCS preparation strategy. What has been your strategy, and
yes,
when did you decide to appear for it, and how was your journey? What are the challenges you
yes.
faced? And because everybody who is aspiring to for this exam has a lot of questions, and we are
Okay.
going to discuss some of them because
Yes.
it's
Yes.
going to be useful for them.
Yes. Briefly, I would like to welcome everyone of our colleagues, our welcoming for the upcoming days for them to become an FRCS, in their journey for the FRCS. Actually, it deserves a lot for them, for their career, and also for their patients as well, and taking care of them because it enriches your knowledge. The FRCS exam actually most of us, since the start, we are taking it as an exam to improve our career and our future to join a great opportunity to have a job in UK and to improve our surgical skills as well as our daily practice. While during my journey in the FRCS, I found that really it affects your daily practice with your patients, your confidence during practicing and during doing your decisions with your colleagues and your mentors.
Yeah.
Your basic knowledge regarding the source of reading, it doesn't matter. You can read whatever you want to read from any source. But my advice to go through the essential notes of Donati, it is very helpful. It
Yes.
is very organized. It will help you in the first part and also in the second part. It gives the topics by assembly. You can see that all the topics of urology in this essential notes, and also it take paragraphs from the Viva book, and it will help you in the future for the second part. The most important thing in practice, I MCQ for the first part.
Yeah.
In my exam, it was MCQ and EMQ, and the EMQ was very strange.
Yeah.
But now it is two papers are MCQ. So you can go through the MCQ, this scientific basis of urology book, this Oxford Handbook of Urology or Oxford Textbook of
Yeah.
Urological Surgery, also the AAU guidelines. This is the main sources that you
Yeah.
can go to these reference books and get the knowledge from it specifically
Exactly.
for
Absolutely.
some
Absolutely.
weakness. Everyone know his weakness point.
Yeah.
For example, in oncology, you have weakness in oncology. You go through oncology questions. You don't know any explanation for the answers. Go through this textbook and just pick
Yeah.
what you want from it.
When you solve a question, you go back to the textbook and you find that you find
Yes,
two more extra things, and those two
yes,
are also potential questions. So it's always
yes,
better that when you're doing a question, don't blindly read the explanation with the question. Try to go back and read the textbook and find out the reference from there. I would say is just don't blindly read the notes. Try to understand and develop concepts because the questions
yes,
nowadays, what I feel, has become more conceptual rather than straight lines. So they're not just picking up percentages; they are
yes,
making a whole
yes,
conceptual scenario and they are
yes, of
making
course.
a question out of it. So I think
Yes,
understanding is also important at the same time.
yes, of course. So this is for the first part. Then for the second part, you can go through Viva book. It's very important.
Yeah.
And the way to pass the second part is how to deal with your cases in the daily practice.
Yeah,
What you are doing when you are studying for the second part, as you base you make the base for your knowledge for the first part, you can start doing what you are reading in the Viva book in your
right.
daily practice. And this is the best way to pass this second part of Viva exam. For example, in my progress note, I try to put my progress note as you see in the daily practice, the urinary tract infection, stone disease,
Yes,
prostate cancer, bladder cancer, like that. So you try to make the assessment, the examination, focus on the points that you missed from
exactly,
your reading
exactly. Very important.
in
Very
your
important.
practice with the patient. So I ask about the history, what items I missed in the history, like that. Go back to the reading,
Exactly.
and
What I
this
used to
will,
do is from your what you when you
yes,
suggested this during my preparation time, what I would do is
yes,
even when I'm seeing a patient, suppose of BPH or a male LUTS, so I
yes,
would make sure
yes,
that okay, I don't forget anything. I don't
yes,
forget the
this,
bladder diary if the patient has storage symptoms. I don't forget IPSS. So I
of
should make
course,
sure that everything what I'm actually going to say, I'm practicing that. So
yes,
and
of course.
because of communication
This will be
also.
the best and the shortest way to save the
Exactly.
knowledge in your brain. Okay.
That
Even try to encourage yourself how to speak with your mentors, how to speak with your seniors. You should be brave to
abs
describe your knowledge without any fairness, because I know there is some obstacles you will find that your opinion will be different. You have the new guidelines and you want to transfer the knowledge. Learn yourself and teach yourself how to bypass these obstacles.
yeah,
This is very important,
very important. You're right.
don't encourage yourself always to speak broadly
Hmm.
and to transfer the knowledge you have from reading of the FRCS or the guidelines to your seniors, to your colleagues. And this will help you also to know how to transfer the information. And
Yes,
this will help in the station itself.
very important. Even when you are teaching your juniors, you learn a lot from that. So teaching
Yes,
should also be, you should also try to impart your knowledge so that when you are teaching someone, you understand your weaknesses and you try to work on
yes,
that and you try better get better with time. So I think that is
yes,
very
of course.
important that every FRCS candidate should be keeping in mind. So all the
Yes,
words,
of course.
I think every word that you are saying right now is going to help every candidate. Everything that you're saying is important, and
Yes.
everything has.
For the preparation of
Mm.
the first part, you have 3 or 4 months, I think is enough. Three or
Okay,
4 months for the preparation of the first part. For the preparation of second part, it will go through all your practice
okay,
on daily basis.
okay.
This is the best way and the most easiest way. Okay. Then during the preparation for the actual preparation before the exam for the second part, a group study is very important. You should have a group study. This group not only depend that you are listening to someone who is speaking about the cases or make the case discussion. You should share. You should learn how to create a case scenario
Exactly, exactly. So,
as a Viva. You
right,
can create the case scenario from your daily practice cases.
yes. So, what I would say, what actually I've learned from you only, we should not just stick to the cases. We should not limit our knowledge what is given in the Viva book. So that case you might not get cases which is just limited to a textbook. Okay, so you might get something which you are actually practicing daily, like you have got an
Yeah,
intra call during a hysterectomy, ureteric injury. So any situation like this, we should be very confident in
understood.
approaching, and we should be very safe in
Of
approaching
course.
these scenarios, which actually we are not even prepared mentally. So we should try during the practice, we should try to bring up these scenarios as well.
Okay. For يعني to the candidate to be focused, what I want to say, as I said in our Viva practice group,
Yeah,
the exam itself like a football match, or you are playing a game. You
right.
should be very trained for the exam station. It's 8 stations. Okay.
Yeah,
In every station you have two scenarios. Every scenario will take 10 minutes. You should be prepared well how to deal with the table. So you have to review your materials as same as the station itself. So you have stone and infection, so you will read stone and infection together and review it together.
Right, right,
BBH and andrology together. Urotechnology, one station. Neurology and female urology, one station.
right,
Bladder tumor and renal tumor, one station.
right.
Prostate, penile, and testis, one station. Pediatric, one station. Trauma, one station. Okay, so you will find that there is some topics have one station, and it seems that this topic is very small. For example, trauma and
Right.
emergency, it's one station. So you are studying BBH for
Yes.
all your life, and now you will find that BBH you will have only 10 minutes
Only
scenario.
10 minutes, right? Only 10 minutes. So
Only 10
you
minutes
have to be very
scenario.
concise and consolidate things together. So that is very important.
Yes,
And when you're
yes,
consolidating things, make sure you are studying these topics together. Otherwise,
yes,
then you will not be able to recall that in the exam.
yes. And during the Viva practice group, it should be like the same like that. Don't do
Exactly.
stone, and tomorrow I will do bladder tumor, and then I will do trauma.
Yeah,
It's
you
like
have to
you are
take it together, right?
organized your brain by the
Absolutely.
topics, and you can recall it in the station, because the time limit is very difficult and
Absolutely.
very important. Okay, so this is the first advice. Second advice, uh, you should anticipate what the examiner will say to you. So you go to the stone table, then
Yeah.
he bring for you X-ray. He will ask about, of course, what you see in the X-ray. You will say, I see a radiopaque shadow occupying the renal pelvis or the renal shadow.
Yes.
So this mostly a staghorn stone. Then the second question, you anticipate that he will ask you about the investigation.
You're right.
So you have to know when to stop.
Yeah.
Even you are a surgeon,
A
the
very
surgeon
important point. Know when
advise
to
when to
stop.
stop.
I think
When
everybody
to
should
stop.
know when to stop. A very take home message.
Even in our practice, when to stop.
Right. We
Okay.
should know. We should
So
not keep on talking because we should let somebody speak as well.
yes,
You should know
yes, yes.
when to let the examiner speak as well. Just you
Of
have read
course,
a lot of those, just don't vomit out in the exam.
of course, and put on your mind that he carry a paper like this
Exactly.
during the exam,
Right.
and he is writing in this paper. There is another one beside him writing in the paper, and there is a completeness of scenario need 10 or 15 questions. You should reach the end of the scenarios.
Exactly.
This will give you the
Maximum.
best mark that make you pass the station.
Yes.
So don't consume your time in speaking about and expressing your knowledge for nothing. For one question, you will open a gates for yourself. You
And
will open gates for yourself
right.
without any value.
Great words, sir. I totally agree with you. Now, one question that I frequently get asked for those candidates who are very slow in their English and they are very concerned that if they speak quickly, probably they are going to have problem in their English language. So this question,
Like me,
no, most of us have. Most of the
most
international
of us,
candidates have.
of course,
The
of course.
international candidates definitely
Eh,
have this problem.
my my advice in this to save paragraphs in your
Exactly.
mind
Right.
and practice yourself on it.
And speak
And this
small
is
sentences.
big, small, intensity,
Right.
short.
Right.
And it is like a ping pong. He asks you, what is this? This is
Exactly.
an CTKOB. What you see? I see stone in this side. We will not differ in our English regarding the medical
Yeah, exactly.
terms.
English should not be a problem in your
Just
management.
yes,
Like you should
yes.
short sentences.
Medical terms, no
Exactly.
problem in
You
the
should be
medical
able to
terms.
just communicate your feelings in very small sentences, and examiner will be very
Yes,
happy with that. They are not going to
yes.
mark you based on your language. This is not a language
Of
test.
course,
This is just
he need
yeah,
the information. He need
information
the
and like
information.
as if you are talking like a consultant. That's it.
That's it.
Yeah.
So there is he will give you a paper, a blank paper with a pencil
Right.
in front of you. While he start to speak about the scenario, okay, you
Yes.
should write the important things. For
Very
example, male patient, male or female, what is the age, any laboratory he will give to you, any brief for the history. My advice also, before you are going to the station, you should put a scheme in your mind.
right.
For example, for the BBH station, I'm going to the BBH station.
Right.
There is some point in the BBH station that you will transfer from medical treatment to
Correct.
surgical treatment.
Right.
you should put the risk factors for progression in your mind, like risk factors for progress to urine retention. Okay, so you need to know from the whole scenario what is the prostate size, what is the IBSS score,
What is the
what
PSA?
is the PSA, what. Okay,
Yeah,
so you are like someone make hunting.
exactly.
Okay,
You should pick up
or
all the
fishing.
keywords the examiner is offering.
Yes, you are making
Make sure
fishing
you are
and start
writing it down and never asking the examiner again.
write it. Yes, and what happened with me for this, for example,
Yeah,
I forgot to say to the examiner what happened in the BBH station. I forgot to ask about the uroflowmetry. I forgot the Qmax. I forgot to ask about the PSS, the prostate size. So when we are go through the examination, the the exam, then he started to put me in a very embarrassed situation, and he asked me, "What you will do next? What you will do next?" I'm stuck. So I come back forward, step back,
exactly.
and I told him, kindly, sir, sorry, I forget to ask about the Qmax. I forget to ask
Yeah,
about the
very, very important
renal
advice.
function. I
Again, a
forgot to
very
ask about
important
the
advice.
prostate size.
Yes.
He looks to the examiner beside him, and he was very happy
Yeah, the examiners
because
are very forgiving. They are not going to punish you if
yes,
you say sorry, you have
yes,
got it.
of
They are very
course.
kind examiners. So obviously
And
they are not
that
there to
time
screw you.
he considered that there is some stress on you because of the exam, and you have time,
Yeah.
and you repeat and correct yourself. This give you marks, by the way. This give you marks during
Yes.
the examination.
Yes. Absolutely.
Okay,
Absolutely. Very, very important advice.
that's it. And for the pediatric station as well, pediatric station is very important. Urotechnology, trauma. You can take many score marks in this station, and don't bother yourself, for example, by prostate cancer. Prostate cancer will be only 10-minute scenario, 10
Exactly.
minute
For
case.
you read for 1 month, 2 month continuously prostate cancer, but you need to keep yourself organized to present everything within 10 minutes. If you
Okay,
have
that's
prepared
it.
that well, then only it's worth spending 1 month. Otherwise, it's not worth. You need to
That's it.
consolidate
That's it.
things and bring it very close. And one question that I get frequently asked, what about the percentages? How to remember the percentages? Both for section 1 and section 2, they are very fond of asking percentages. So
Yes, actually,
how would you manage to remember them?
okay. Uh, First of all, try to not tell any percentages unless you have been asked for it.
Okay,
Second, if you save in your mind some percentages which is important, you can tell it.
right.
If you are not sure, don't tell it unless he ask you about it. If he asks you about the percentage and you say, I don't know, sometimes he will insist. Tell me estimation. You can know from your practice, from your study, is it rare?
Right.
Is it usual? Is it common?
Use your common
So if
sense
it
in
is
that. Yes.
common, yes, use your common sense. If it is common, tell him it's mostly above 60%.
Yeah.
If it is not common or rare, you say below 10%. Like that. Don't give
Yeah. So
an
I what
exact number like 17%. Like that. You are not sure. Like
exactly.
you say
Even
17%.
but whenever they talk about complications, I think even in my exam, I remember they ask about percentages, especially in complications. When they ask about what is the complication rate of this undescended testis or orchidopexy. So they ask about details of complications, atrophy rates, and all.
This is a good question. This is a good question.
Yeah,
So while you are studying, you should focus on the percentage that will be valued for the patient,
right.
that will be
Exactly.
valued for the patient,
Exactly. Every
not for the
percentage that,
exam,
yeah,
not for the
exactly.
exam, for the
Exactly.
patient. And for example, you are counseling the patient regarding the transrectal ultrasound biopsy. So what is the percentage of infection will happen? What is the percentage of bleeding will happen?
Yeah.
That's very important,
Because
and you
that's
should tell
something
the
you need
patient.
to know for before you take the consent. And even like certain things you need to explain before you take the consent. So those percentages you have to remember, especially these
Yes,
things that you
because the patient will ask you in your clinic how, doctor, this will happen for me, and you
right.
have to explain for him how much it will happen. So the examiner will not forgive you if you tell you will have erectile dysfunction by 90% after TRB, for
Right.
example. This
Right.
is not well. This is not
Yeah.
make
Even
sense.
even
You know.
for the emergency scenarios, for a renal trauma, especially, if you don't know the percentage, like what I feel regarding the conservative management, what is the success rate of NG embolization, what is the success rate of what
Yes.
is the nephrectomy rates of a grade 5 trauma? I think they're very fond of all this because your counseling
Yes.
depends on that. The first meeting when
Yes.
you're
Of
seeing
course.
the patient will ask you, and you need to counsel them. So you have to
Of
know
course.
all this by heart because the examiner expects that you are doing it every day, that you are using these
Mm.
percentages every day.
Yes. Of course. That's it. The day of the exam, my
Yeah, very
advice, if you
important.
are
What to
traveling,
do on the day
yes,
of the Viva exam, because
yes,
many are actually stressed that if I mess up one
mm,
station or two station back to back, it's very difficult to focus on the third one. Even we say that forget about the previous one and focus on the next one. It's very easy to say than done. To forget
yes,
about the last one. Even for me, one station did not go well, the female urology. So it was very difficult for me to focus on the next one, but we have to do it.
yes,
Otherwise, we are not
yes,
going to do well in the next one. So what is your advice on that?
yes. My advice started prior to the exam, in the days before the exam.
Okay,
You first 4 days before the exam, at least, or 5 days, you have to just read from one source.
okay,
Even if you read from the Viva book, okay, read the Viva book. Don't read anything else because too many informations will come to your head and
yeah,
useless. You will not. Don't bother yourself. You will remember everything during the station. Your
oh,
studying will not go through the garbage. It will not go to the bin. You will find it in the exam. But if you make haphazard reading before the exam, of course you will be not organized during the exam station. So
right,
try to be relaxed. I advise to take these 4 days in the same hotel of the exam itself.
yeah.
Then the night before the exam, you should have a very good meal. I'm not
Very
joking,
important.
really a very good
And
meal
most of the candidates, they
with
don't
with
eat,
a
they
good,
don't sleep well,
yes,
and
yes, with a
the
good
performance
starch
will
and
not be that
good
good if you don't
carbohydrates,
sleep
and
well.
yes, and the protein as well. So you give yourself a very good meal to sleep well, and take a very good shower in the night. Stop reading after 9 o'clock by any way. If you didn't
Very
complete or
important.
didn't finish, don't read anymore. In the morning of the exam, go early. Try to take your coffee. Prepare yourself well for listening to the interview, to the induction from the chairman of the examination,
Yeah,
for the chairman of the exam. This will make you relax. When you start your station, every station, consider it a separate exam. Don't think about it after you finish. Go through it. Don't speak with your colleagues around you about what happened inside, because what happened with your colleague is mostly it is different
yeah. The
than what
examiners
happened
have
with you.
multiple case scenarios, so everybody will give different
Yes,
scenarios. If you discuss it, you are going to get biased.
of course. If you just want to know what he is asked for
Yeah,
example, he asked me for bladder diverticulum, prostate abscess, like that. Okay, this will help just to organize your brain, uh, to think what you will speak about. But
yeah.
even don't bother yourself, because uh, it will, some people, this will disturb their brain.
No, actually, I will
Okay.
give an example. For example, a candidate, he went out and he said to his colleague that he got a pelvic fracture. He got a road traffic accident, and probably he got a posterior urethral injury scenario. And he told his friend, and his friend went inside. He got the same road traffic accident, but this time he did not have a posterior urethral injury. He had a bladder injury. So the scenario
Yeah.
was completely different, and but he was mentally occupied with his posterior urethral injury. So the
Yeah.
words he was saying was totally biased towards the posterior injury, urethral injury. So that was a big problem. So it's always better
Yeah.
that you go with an open mind, sit,
Yes.
stay calm, grab a coffee whenever you want, but don't discuss
Yeah.
in between the sessions.
Of course. And even after you finish the station, don't think what happened. Close it
Close it, right? Absolutely.
and fight until the last station. Fight. It's your day, and this day will not come even after 1 year again to
Yeah.
appear again. Okay, with all this stress on you and your family and your work, like that. So you will fight until the last station.
So one more question. Thank you so much for all the advice. I think everything that you
Thank
said,
you.
every candidate can relate to them. Like whoever is
Thank
preparing or
you.
whoever has gone through this journey would definitely relate to this. But one problem that most of us face, how to balance the work and life. Like there is some problem in balancing this. How much time every day should one dedicate? Daily, how much time
If
should
if
one? If
if
I
I
think
tell you
most of
my
us who's
advice,
supposed to prepare have a family,
I
have a
think my
campus.
wife will fight with me after.
So we want to know
Actually,
actually how much
this
time should a
this
candidate
need
actually devote time per day?
actually this depend our knowledge, our skills in studying is not the same.
Yeah,
So I cannot say 2 hours for Ankit, and Ankit is more smarter and more skilled
correct.
than me, and he will study and save in 2 hours.
No, I
Maybe I
think,
will need
but
four
still we
hours.
should know.
What what is my advice really? That
Yeah, please.
every person know his capability,
Right,
and every person should speak up with everyone around him about his situation, especially your family. You should involve them in your situation.
right.
Don't say I will go to study for no reason. You were studying yesterday, you will study this weekend. What is the reason? Like that, you should involve them in your situation. They
Right.
should share together what you are doing, because this will help to relieve too much stress over your shoulders, and this will help you to have encouragement and more concentration during your exam. But my advice, to not cut your family life for the exam, because it will not work like that. You should have time for your family, time for your hobbies, and even for walking, for doing sport. This will increase your blood supply, increase your brain blood supply, and help you really healthy food.
Yeah. So thing is,
Try to be happy.
yeah, try to be happy and be your natural self when
Yes.
you are writing, when you are going for
Enjoy,
the even of
enjoy,
the exam.
enjoy this
Enjoy this
journey,
journey.
because you will remember it for all your life. Enjoy it.
Exactly. Don't stress yourself. Don't just
Don't stress yourself.
don't take
It's just one
unnecessary leave
day.
from your duty,
It's
from your
it's that
hospital.
just one day.
Don't stay at home and
Yes.
study. Because I've seen candidates taking
Yes.
1 month leave before this exam. 1 month leave just to study for the section two. Because the actually, I think the stress
Mm.
is not about the failure. I think the stress is for the cost of the
Yes.
exam. I think it is
Yes.
stressful
Yes.
to appear for it because it's a very expensive exam. I think that's why
Yes.
most of the some candidates have now started taking a lot of leaves and prepare. But still, I would
Yes.
recommend what I understood. Like it's 5 days
At
leave
least
or
two
daily.
weeks.
Yeah,
2 weeks. Two
yeah,
weeks is fair enough.
yeah,
Two
yeah.
weeks
Don't
leave is very important
exactly.
before this exam. You should
But
take
the thing is, 2 weeks
two
or
weeks at
don't take
least.
a month of leave. That is not going to actually help. That is going to further create a pressure on you. Just a take-home message for someone who is writing this November exam, November section two, and January section. Both are one is the international,
Just
the UK based exam. What is your advice for them?
my advice that you passed a very good time, very good preparation. You are doing good for yourself and for your family and for your patient in the future. You are doing a very important thing in your life, and don't be stressed. Uh, Take it seriously, but not hardly. And you can do it. Everyone did it, and you will pass, and everything will be as a memory in the future. And you will return back to this reading, because it will help you in the future in your career.
Yeah, exactly. What I feel that whatever you read during a preparation time, you remember it for a long time, and you can apply this even in your practice afterwards. So you
Yes, yes,
overall you
yes, of
become
course.
your knowledge becomes better. Your you overall it's a growth of a personality. If you pass this exam, this is
Yes,
that doesn't matter. I think pass or fail doesn't matter. But preparing for this exam makes you a different person altogether.
of course, of course.
And
It
you will
will
be
change your life.
change your life, change
For-
your personality, change your
will change
thinking
your life.
process, and your counseling with the patient. Everything changes with this exam preparation.
Yes.
And again, very thank to you, Dr. Abdelazem, for giving.
Thank you, Ankit. Thank you.
I'm
Thank you.
seriously,
You are
uh,
welcome
I'm
anytime.
seriously thankful to you for all this experience that you shared, every word that you shared. I think everything is important. The way we should approach the exam for for the section one. Great advice from you. Everything again, whatever you said, I think is going to help all the candidates who are going to appear for this November and January section two exams and the July section one exam. And again, we have a section
Good
1 in
luck
September.
for
So yeah, so good luck from us to
thank
all
you, Uncle.
of the candidates.
Thank you.
Thank you so much,
Good
Doctor.
luck. Of
For
course,
all-
good luck for everyone. I hope success and
Yeah,
happy life for everyone.
thank you so much. Thank you so much, and
Thank
hope
you.
we meet again.
Thank you.
And we keep sharing the experience, and we keep helping the students who are actually want some advice and guidance in this preparation.
I'm ready for anyone anytime, and thank you for involving me in
Thank
this
you so much.
experience
Thank you so
and
much.
to give me this time to
It
give
was
my
our pleasure
advice.
to have you, because it was such a yours have such a
Thank you.
busy schedule. Your skill scrubbed in your skill on duty, I think, and still you took out time for me. So it's a
Actually, I didn't.
for me. Thank you so
I
much.
didn't make. Okay, thank you very much.
Thank you so much.
Thank you.
Thanks.
Thank you.
Thank you.
See you. Bye
Thank
bye.
you.